Hello, my name is Dr. Rich Lee. I'm a family physician with 30 years of clinical experience. My practice is a small concierge practice in Portola Valley, California, and I've been struggling for at least the last 2 decades to improve people's health, not just treat them or keep them out of disease. And I'm so happy to see that it's actually working, and to see the results of this has been very rewarding to me, to myself, and to the patients that I know and love. And I'm very grateful and honored to be sitting here with Daniela Diab, who we've known for probably 20 years.
Yeah, I've been working with Dr. Lee for at least 2 decades. And like him, I've been working in the health and wellness sphere in the Silicon Valley. And, my mission is to help people find simple ways to impact their lives in big ways, to move forward, and never get stuck. I'm always trying to help people get unstuck
Right.
with these ruts that we all get into. And I would say one of the biggest ruts people get into is, doing the same thing for decades sometimes,
Right.
thinking that they're going to get a better result. Like they used to do cycling or whatever in their 20s and 30s for a couple hours a week, and now they're gaining weight, so they're going to cycle more. They're going to eat lower fat. They're going to eat less calories, all those kinds of things. Do you see that in your practice a lot?
Well, yeah, and that was me 20 years ago, too, when I've been a cyclist all my life, and I weighed 30 pounds more. I'm healthier now at 68 than I was at 48, partially from following the advice I gave to patients and the advice I'm learning from them. And in fact, I learned from everyone, and I've learned a lot from you. So it's a mutual admiration society.
Yeah, we have a good time, Dr. Lee and I. One of the things I currently have, I don't know, 5 different clients who are either considering getting on a GLP-1, getting on one for sure. I have a couple clients I'm playing with a new probiotic that you might have heard of from Pendulum. It's an Akkermansia, deuterium, and a couple other things that are supposed to enhance your GLP-1 pathways naturally.
Right. Yeah.
And I'm not really sure. We're sort of feeling it out. I don't think it's going to hurt them to try this probiotic combination.
No.
It's certainly a lot cheaper than getting
Yes.
injected every month.
Yeah.
Have you been prescribing this at all?
Yes, I have. Now, the first group are obviously the high-risk type 2 diabetics. And
Right.
that's the only group that maybe insurance companies will pay for this. And typically, the street prices for all of them, there's 5 or 6 now, are over $1,000 a month. So that's a hurdle that hopefully will be lowered over time. As soon as the supply equals the demand, you may see the prices come down. And they work by 2 primary mechanisms. One is to prevent the blood sugar roller coaster from going crazy. It raises the floor and lowers the ceiling of blood sugar. So for the diabetics where the ceiling's too high, it brings it down. For the people who become overweight because the blood sugar is always crashing, it brings it up. So that's one method.
Oh, that's interesting.
Yeah. Second is it delays gastric emptying. These are the main reasons that the FDA approved it. So if your stomach's more full, you're not going to want to eat as much. And that's one message for reducing the appetite. It may have other factors on fat modulating hormones like adiponectin and another one called ghrelin. But in terms of the FDA approval, the 2 things that it got was that. So there may be other nuanced properties to it that we are just exploring, mostly exploring beyond the hardcore allopathic medicine route into the people who deal with nutrition and the deeper science of why people gain or lose weight.
Right. And so part of my concern with these drugs in particular, especially at the higher doses, is that people aren't forced to make lifestyle changes, and yes, they're probably eating better because they're eating less.
Yeah.
But it doesn't necessarily mean that they've made the switches to maintain this over the long term. And I feel like every one of these prescriptions should come with, a prescription to work with a nutritionist or a dietitian or a health coach like me to help people start moving and drink their water and get some sleep and, all of these things that are critical.
Well, this is a problem with healthcare in America in general. we're taught and retaught to hyper-focus on there's a drug for everything. And all you need to do is take a pill or take a shot, and it'll take care of all your problems. You don't have to make any other differences or changes in your lifestyle. So, and that's probably one of the reasons why when people stop this, their weight comes back again. So they're not, this is a treatment, it's not a cure. It treats an issue or a problem, but it doesn't solve for what caused it in many cases in the first place.
I think we need to slow that down for a second, because what you said is really important. It's a treatment, not a cure.
Yeah.
And that applies to a lot of things.
Everything
right?
in medicine practically.
And I don't think people think a lot beyond what happens a year from now. What happens 10 years from now.
No.
And I just feel good, look good, right in this moment. And it's a lot of Band-Aids being put on bullet wounds here. It doesn't necessarily fix the root cause, which is what I do all day.
Yeah.
I'm working on root cause.
Right.
And that's one of the reasons I get along with you so well, is unlike a lot of, Western medicine doctors, you really ask your patients questions like, how do you feel? How could you feel better? Where do you think this started? What else is going on in your life that might be contributing to this problem,
So you touch on something. We don't solve for the why of anything. We get the what. What do you take? What do you take for this? But why you're in that position in the first place, as physicians, we're not taught that. As people, we are not encouraged to ask those questions anyway. Just give me the answer. Give me the what. Don't ask me why. I don't want to know why. Where that's the root cause of this.
Exactly.
And the why isn't that complicated. You just have to ask the right questions for it. Our attention spans are getting too short to really consider that, and that's where we need to step back and just take a deep breath and ask for that. The two things I ask my patients when they first join my practice is, if I could wave a magic wand and grant 3 wishes for your health or quality of life, what would they be? That's an important question to ask anyone. If you don't know what they want, how can you pursue that? The second set of questions is, what do you worry most about your health?
Right. And that's where the why comes in.
Yes.
And that's a huge part of my practice. And in the book, I talk a lot about figuring out why. Like if one of those 3 things that they want the magic wand to make happen is to lose 20 pounds.
Right.
Why?
Okay.
Is it because you just want to look great in your clothes? Or is it because you can't exercise with your wife? Yeah. You can't spend time with your children or your grandchildren. Yeah. There has to be a more emotionally charged reason to accomplish that goal.
Well, when you solve for the why, then whatever you're doing to treat this over time becomes less and less necessary because you're correcting the problem in the first place. I'm so impressed with what happens with all the people in my practice who apply this. I'm happy what it did for me as well. I feel better than I did 20 years ago.
Ditto.
And I'm 68.
Yeah, no, actually, when we met about 20 years ago, you were a little bit heavier.
I was 30 pounds heavier.
And I was miserably thin, and my health was suffering. I couldn't get pregnant. Yeah. I had foggy thinking. I wasn't sleeping at night. I mean, there were so many things going on for me. I wouldn't take my 27-year-old body. I wouldn't swap it for anything. No. I'd take 47 every day of the week. Huh. Yeah. But that's because, and it's not to say that we do everything right, but we've made some changes. And that's, another thing that we started off this conversation. It's like the things that I did 20 years ago to move my health in a better direction, they're not going to work anymore. Those 4 hours of cardio I was doing a week, they don't work for me anymore. No. Now I have to lift weights 4 hours a week. You know what I mean? It's a totally different game. So yeah, it's I'm sure the things that you did.
Yeah, I followed my own advice finally.
It's hard to do sometimes, isn't it?
Physician, heal thyself. But if you look at the health of a lot of doctors, they're not the paragon of health, especially in primary care, because they're just overwhelmed. And it's all about the paperwork and the 5-minute visit. So you're not likely to get this from most of your physicians. They're not trained in it. It's been a 20-year learning cycle for me. For 10 years, I had clinical nutritionists in my practice who taught me everything they could before they left, and everything they mentioned, I checked against the medical literature, and I found the evidence there again and again. in peer-reviewed medical studies. The problem is these aren't drugs that are profitable. So,
right.
yeah.
And he had me work with this nutritionist when I first started with your practice, quite a few times actually. And, when you're talking to your personal trainer about nutrition, they don't necessarily know what they're talking about. Because let me tell you, I thought I did, but I didn't. And and
it's not her, by the way.
I'm not a trainer. And I didn't realize that eating low fat for so many years was just tanking my hormones.
Yeah.
No wonder I couldn't get.
That's where they all come from.
Yeah, absolutely. So, maybe that could be another topic of conversation we could touch on is the sort of low-fat diet craze and what that does to our physiology. Not good.
So you mentioned briefly probiotics. There are several things. The gut is a second brain. There are more cells in our digestive system than in our entire body. We're just at the beginning of understanding what these are and how they work. And it's very complex because it's like every living thing in the rainforest in your gut that's changing seasonally. So those who struggle to identify it, and I've met with the CEOs of companies who are trying to do that, it's still a long way up, but there are elements that we're beginning to understand.
Yeah. It's come a long way in the last 10 years or so.
Yeah.
But it's still, there's a new documentary on Netflix. Have you seen it yet?
Haven't seen it.
It's called, I think it's called Heal Your Gut or something like that. And it's good. It's cute, and it gives you a lot of information about, how important, eating fiber is.
Right.
And I think that one of the things I really liked about that show is it reminds people that you need to be getting most of this stuff from your food first before you're popping the pill.
Right.
And to your point, yes, we have a better idea of what a healthy gut microbiome should look like.
Right.
But what are the probiotic strains that are going to help you achieve that and to fix that dysbiosis?
Right.
It's
okay. So when you're eating for you, when you're feeding you, you're feeding all these guys as well.
Right.
And they are affected by the same free radicals and oxidation processes and illnesses that you are. They contribute to your inflammatory process or your anti-inflammatory process. One of my friends is a bariatric surgeon. So he does surgery for weight loss. But he told me at dinner that he's working on the day when his surgery will become obsolete. And when I asked him why, he leaned forward and he said, well,
really? That's great.
Yeah, he's still working on that. And the last time I saw him, he said, how's the probiotic thing going? He said, well, we're still working on it. But he told me about a patient who had a severe inflammatory bowel disease. And instead of surgery, they did a fecal transplant, which cured the inflammatory bowel disease. But the problem was the transplant came from an obese person, and this person became obese.
Right, and I've heard this a lot, I mean, they talk about like twins. They take identical twins and transplant, do the same, fecal transplant, and the one will get overweight and the other one won't. So, there's what we don't know about this, and I got to tell you, the idea of a fecal transplant, I'm not trying to
don't go there, okay?
But it's, there's so much to say on this one.
Well, so the more I know about that, the more I don't know. And that's kind of the way of medicine, because there's so much more to discover. But there's the issue of how that affects your own weight and health. The one thing these two CEOs of these companies who are leading the research and said to me is, regardless of what we know and don't know, the healthier diversity of colorful foods in your diet equals a healthier diversity of the microbiome in your gut. And if nothing else, focus on that.
On colors and variety.
Color, yes.
Yeah, and I think it's, I don't know about you, but I think it's easy for most of us to get stuck in these sort of food ruts where you kind of eat the same things all the time.
Yeah. And
I go into a little bit of detail in the book talking about how, you should try to eat for the seasons to some extent.
Yeah.
Like all you have to do is go into the grocery store, the farmer's market, and whatever's on special, guess what? It's in season. So that alone is going to help you make some different choices, broaden your variety of fruits and vegetables.
Remember, 5,000 years ago, we ate that way.
Exactly.
We didn't get stuff that was out of season.
Not long ago.
No.
50 years ago.
Yeah, before we started messing up our food. So think back to that as a baseline. I usually tell people, if nothing else, if the food in its natural, raw cooked or pureed form will stain a white cotton t-shirt, it's going to be better for you. So
That's good.
Stain is good. Eat the rainbow, not taste the rainbow. That's the Skittles thing. And actually, the colors in that are headed for an FDA ban.
Is that finally happening?
Yeah,
it's really frustrating. Yeah, it's really frustrating to me hearing about how even in Canada, just a little bit north of us, there are certain foods that aren't sold. There's just the American version of these things because we still allow so many of these chemicals into our food supply, and it's destroying. I mean, what it does, we didn't really talk when we were talking about probiotics.
Yeah.
I wanted to touch on how our gut health impacts our brain health.
Oh, yeah.
And, even though every single person I know has experienced the jitters, right? The anxiety, or you've had a, horrible fight with your spouse and you get that sort of sick feeling in your stomach.
Never.
Or you're going up on stage and you're getting a little bit nervous and you feel those butterflies. Well, that is your brain and your gut having a conversation, and just like your brain can tell your gut, hey, things are a little bit scary. Maybe we should shut down digestion right now. Well, your gut can tell your brain the same thing, right? So when your gut is unhealthy and there are not healthy chemicals bopping around in there, you get a signal to the brain that says, we are not well.
Right.
You should stay home. You should close the curtains and stay away from people. It works both directions,
The gut is the second brain. Now that works in terms of neurotransmitters for both. Serotonin, there's more serotonin in your gut than in your central nervous system. What's even more interesting is a lot of that serotonin is produced by the metabiome. We know
what is the metabiome?
Those are the microbes in your gut, what your microbiome, whatever you want to call it. So they are critical in the production of serotonin, among other things, that gets into your central nervous system, into your brain. Serotonin is a neurochemical of calm, order, and hope. Now, we started to understand that because there are studies for people with chronic anxiety. When you gave them a, quote, probiotic, their anxiety went down. The communication goes both ways. So if your brain is more anxious, it will actually affect the serotonin or the, quote, mental health of the microbes in your gut. As weird as that sounds, we're finding that communication runs both ways.
It runs both ways, yes. And you can impact it in so many ways. I'll tell you, I have a teenager at home, and she's had some mental health ups and downs, as had most kids during the pandemic and post-pandemic.
Only worse now,
only worse now. And there are some things that we know make that mental health better. Now, we've had therapists tell us, we should try this medication, that medication. And I've always said no, because do you know what? You take that little girl, you stick her outside in some sunshine. Yeah. She's fine. When things
without the phone, by the way.
Without the phone, without the phone. And we've recently, I have her on some simple supplements, omega-3 to keep her brain nice and healthy and her cells healthy. Vitamin D.
Yes.
She's got very dark skin, so we want to make sure that she's getting plenty of that. A multivitamin with methylated B vitamins in there so that she can detoxify. But also, we just added in a probiotic. And the difference was almost overnight, to the point where she's afraid to skip her supplements because she knows her anxiety will increase if she doesn't. Now, that could be placebo effect.
No, the evidence is there.
I tell you, it was remarkable for her to go, Mom, I think that thing really works.
For a teenager to have that much insight in this world of chaos, that's
well, she is my kid.
Yeah, so she's an old soul, but it's still telling, And it may not work for everyone, but at first, the first rule of medicine is do no harm.
Yeah.
And you're not going to do any harm with that. And definitely better to do that. Solve for the why before you have to treat with the what.
I love that. Solve for the why before you have to treat with the what. We're going to put that on a t-shirt. That's pretty solid.
Why? Why?
That's good.